Tuberculosis is a very common infectious disease in our country, and we have the goal of eliminating it by 2025. Hello friends, I am Dr. Vivek Nangya, Principal Director, Pulmonary, Critical Care and Sleep Disorders at Max Hospital Saket Complex and Chief of Pulmonology for Cluster 1 Max Healthcare India. So do you know what is the incidence of tuberculosis in our country? Well, if we see the latest global TB report, according to that report, in 2020, there were 188 cases per 100,000 population. And this number rose by 19% in the next year, that is in 2021. And the attributable mortality is around 34 per 100,000 cases, which also has risen by about 11% in 2021. Tuberculosis is spread by droplet infection or aerosol infection. That is, if there is a sputum positive patient who's coughing, who's sneezing, laughing, talking, he's generating some droplets in the air, which are then inhaled by innocent bystanders who are present around him, and these bacteria then go inside the bystanders and their immunity suppresses them till the time there's a breakdown in the immunity. This stage is called latent tuberculosis, when the bacteria are present inside a human being, but they've been suppressed by the individual's immune system. There are no symptoms, but the bacteria are present. This is the time which is, as we call it, the latent tuberculosis, when people get their skin tests or there's a test called quantiferon gold that turns out to be positive, and that only indicates a latent tuberculosis. These tests do not indicate active pulmonary or any other extrapulmonary tuberculosis. Latent tuberculosis usually would have a breakdown whenever there is a decrease in the immunity. That means if anybody undergoes any kind of an immune suppression, which may just be in the form of a mild to moderate viral illness or being on immunosuppressive therapies, malnutrition, smoking, alcohol, HIV infection, and so many other infections which can cause suppression of the immunity, would result in a patient who has initially a latent tuberculosis positive turning into an active TB patient. Diabetes is also another very high risk factor for this conversion from latent TB to active TB. Tuberculosis can involve various parts of our body, starting from the brain to the tonsils, to the throat, to the glands here in the neck, to the eyes, then going on to the lungs, bones, abdomen, lymph nodes. Practically every organ of our body can be involved because of tuberculosis. The most common symptoms of tuberculosis would be a low-grade fever, 99 to 100-ish, with evening rise, associated with a loss of body weight, loss of appetite, and also some night sweats in the night. And then there would be organ-specific symptoms, like if there's somebody who has lungs involved because of tuberculosis, which of course are the most common sites of involvement. Those patients would present with cough, with phlegm, with sometimes even blood in their sputum, breathlessness, chest pain. If it is involving the abdomen, then it could be pain in the abdomen. There could be intestinal tuberculosis, which could be resulting in loose motions or constipation, any kind of altered bowel behavior. There could be lump formation here in the neck, which is called the lymph node tuberculosis. So these patients would present with altered sensorium, neck stiffness, what we call as neck meningism, and it's called tubercular meningitis, and has a very high mortality rate. The diagnosis of tuberculosis is very simple to make. Any cough which is prolonged, lasting more than 2 to 3 weeks, must be investigated for tuberculosis. So you start with a simple chest X-ray, which can give you any infiltrates or any patches that are developing in the lungs. A simple sputum examination that can tell us that if there is bacteria present in the sputum or not. These are of course focusing on the lungs per se. Then again, if it is intestinal, then one might have to undergo endoscopy to see where the involvement is and take biopsies from there. But nowadays we have very high generation tests that are available to us, molecular tests, with the help of which even a small number of bacteria of tuberculosis can be detected in the sample that is being tested. This is called the Gene Expert test. Gene Expert can tell us for sure if it is TB present or not present, and can also tell us whether this TB is sensitive to the anti-tubercular medication that we want to give or not. That means it is also able to differentiate between a drug-sensitive tuberculosis and a drug-resistant tuberculosis. So the entire treatment plan can be based on this one test. Tuberculosis is also of 2 or 3 types. It could be atypical tuberculosis, it could be typical tuberculosis, drug-sensitive, drug-resistant, multi-drug resistance, and now we are even seeing extensively drug-resistant tubercular cases. That is the MDR and the XDR cases. The treatment for a drug-sensitive tuberculosis is very nice and simple. There are just 4 standard medication that have to be given to the patient, which are to be taken on an empty stomach every morning before breakfast. And that's all for the rest of the day. The important thing is that this treatment must continue for at least 6 months. First 2 months is the intensive phase where 4 drugs are given, and in the next 4 months is the continuation phase where only 3 drugs are given, but they're given every day. What is important is consistency with treatment. These medicines can have certain side effects which we are well aware of, and they all can be managed in due course. But treatment should not be interrupted at any cost. I always tell my patients that if you take the treatment regularly, then this TB bacteria will get eliminated from the body completely. But if the course is interrupted, or if you do not take the treatment every day as has been prescribed, then the chances are that this bacteria will keep lurking in your body somewhere and not go completely. It may just turn multi-drug resistant or extensively drug resistant, that is MDR or XDR. The treatment for MDR and XDR has also been revolutionized over the last few years. There was a time when we used to treat such patients for 18 to 24 months, but now there are newer regimes available which are shorter in duration and have better efficacy, lesser side effects. So people with MDR and XDR should not lose hope. We have good options of treatment available for them as well now. As far as prevention of tuberculosis is concerned, well, the best thing is that as soon as a patient is detected to have tuberculosis, he should start wearing a mask. It is said that once the patient has been detected with tuberculosis, he has already infected the people around him. So what is important is, and is now being recommended in India also, it was earlier only abroad, but now in India as well. As far as prevention of tuberculosis is concerned, the patient who is suffering from a sputum positive tuberculosis must wear a mask to prevent the spread to others, remain in isolation for a few days. Usually it is seen that within the first 2 to 4 weeks, such patients turn negative in terms of their infectivity abilities. That is the ability to infect other people. There's also a recommendation now to test all the household contacts of the index patient, that is a sputum positive patient, for active tuberculosis, and if not found to have an active tuberculosis, then they must be given chemoprophylaxis. That means prophylactic medication which will prevent them from catching active infection. Early detection, recognizing the early symptoms of tuberculosis, diagnosing tuberculosis with the help of the most recent diagnostic tests available to us, and starting on appropriate treatment as soon as it is detected can actually help us control this havoc of tuberculosis in our country and help us achieve the goal of elimination of tuberculosis by 2025.